Hello, everyone. This is Javad Parvizi, an orthopedic surgeon at Acıbadem University in Istanbul. I have the pleasure of talking to one of my great friends and one of the most brilliant stars in orthopedic surgery, Dr. Ken Urish from University of Pittsburgh. Dr. Urish is a busy, high-volume surgeon, does groundbreaking research in periprosthetic joint infection. He's currently the president of the Musculoskeletal Infection Society, and as I said, he's a dear friend. Ken, thank you for making time. I know you've got a clinic to go to, so let's get to it. You were there at the ICM. One of the questions you worked on was, are there any anti-biofilm technologies? Can you tell us whether there are any, and then what is the issue with biofilm? Why is it so difficult, and why have we not had any technologies cleared through FDA so far?
Yeah, I mean, Jay, it's awesome to be here. I think you hit it right on the head. Right now, there isn't any approved technologies in general for periprosthetic joint infection. Nothing has gone through the FDA or any of the European agencies that are actually an indication of treating periprosthetic joint infection. And so we were really looking at in our group, are there any technologies that we can use outside of these FDA regulation processes or what's going on that can actually be used to treat periparasitic joint infection. Um, and the problem, and this is what our lab's always been very interested in, and what got me started when I was a resident, the biofilm is just very antibiotic tolerant. And there's many different mechanisms. It can be the biofilm antibiotic tolerance. It can be that it's intracellular. It can be a reduced metabolic state, number of different variations, synovial fluid aggregation. But in the end, you're tolerant to antibiotics. And that's what makes it so difficult to treat. And it's what our patients ask. Why can't I just take an antibiotic to get rid of this infection? And it's because the antibiotics will not get rid of the bacteria.
Right. Perfect. So it's a sessile structure that's impenetrable by antibiotics, and even the immune system of the host can't penetrate it. And once the biofilm forms on an implant, unfortunately, the game is over, which is what
Yep.
you're telling us. Now, the question that you led during the ICM has stated that there are some technologies that could be promising. Amongst them, you've talked about antimicrobial peptide, phages, antiseptics, etc. Can you tell us what you're excited about and how do you see we are going to be moving forward?
Yeah, I mean, the biggest thing with the sort of the ray of sunshine in all of this is that yes, there's nothing out there right now that's officially approved, but this is a really, and actually a lot of it's because when you were starting out this when I was a resident, you're the one that really kind of focused how much of a problem infection really is. And it's been what now 15, 20 years of building this all of these possible solutions to solve the problem. And now we finally have some randomized prospective studies that are in process right now. One of them is with an antimicrobial peptide. There's a second one that's just finished up looking at it's a combination antibiotic device. There's a third product out there that's a special coating on implants to keep the bacteria from being able to attach and develop a biofilm. There's been a few different attempts at using bacteriophage in more salvage cases. And so the bottom line with all this is that there's nothing approved right now, but there's a lot of activity and potential.
Yeah, and I think it's fair to say FDA recognizes, the regulatory bodies recognize the gravity of the situation. They're doing their best to help us out, and hopefully
Yep.
we'll have some of these technologies clear and be available to our patients. So the question that you had worked on was, are there any effective antibiofilm technologies that can be used in clinical practice to treat orthopedic infections? You and your group did a spectacular job. And I think the response that I see here is that periprosthetic joint infection remains challenging to treat because of biofilm's high tolerance to antibiotics. Several different treatment strategies remain in development, including antiseptics, antimicrobial peptides, mechanical disruption, bacteriophage, bioactive glass, and implant coating. 80.7% agreement. That's spectacular. Any last minute words for us, Ken, before we let you go to your clinic to treat those patients with periprosthetic joint infection?
No, it's the ICM was a really great meeting to attend because of it set the example of how much this is truly an international effort across the surgeons, across the basic researchers, across the regulatory agencies, and helping out our patients.
You're the best. Thank you for making the effort to come there. It was wonderful to see you in Istanbul. Thank you, my friend, and congratulations again for that, the presidency of the Musculoskeletal Infection Society. For those of you who wish to attend, next year the meeting will be in Porto. You're doing a joint meeting with the European Bone and Joint Infection Society. Very, very exciting. I'll
Be a
be there
great time.
myself to learn from you, and thank you again for all your dedication and help to our patients. Ken, have a great
Excellent.
day. Thank
Yep.
you.
Take care.
Bye bye.